Eli Lilly weight loss drug cuts diabetes risk by 88% after stopping treatment in a drop from 94%. Pharma giant Eli Lilly has made yet another major announcement for its weight loss drug tirzepatide, which has demonstrated efficacy in being able to help pre-diabetic patients reduce their risk of contracting diabetes. In a release shared earlier today, the drug maker announced that different tirzepatide doses at a weekly interval ended up reducing the risk of diabetes among pre-diabetic patients by as much as 94%. As an added bonus, users dosed with the highest dosage also managed to cut their weight by a quarter. These results came from a 3-year study that evaluated the drug's effectiveness along with diet management and controlled physical activity. Eli Lilly's tirzepatide cuts down risk of diabetes in pre-diabetics by 94% according to the release. Tirzepatide's latest set of results are part of a 3-year study conducted by Eli Lilly called SURMOUNT-1. This study dosed 1,032 pre-diabetic patients with 5 mg, 10 mg or 15 mg of the drug for 176 weeks as part of an extended study that started after the initial 72-week study. These participants did not have type 2 diabetes, and according to the firm, the 3 doses and the placebo were evaluated as an adjunct to a reduced calorie diet and increased physical activity. By the end of the trial's dosage period at the 176-week mark, tirzepatide demonstrated a 94% reduction in the risk of the patients progressing to type 2 diabetes when compared to the placebo. When adherence to the randomized treatment requirements was removed, the risk reduction remained at a robust 93%. Lilly also shared that the trial's secondary objective, which evaluated weight loss, was for patients dosed with 10 mg and 15 mg of tirzepatide to achieve as much as a 22.9% reduction in their weight, depending on their adherence to randomized treatments. Crucially though, Lilly adds that after the 176-week period when the participants went through a 17-week off-treatment follow-up, tirzepatide's efficacy in reducing progression to type 2 diabetes and encouraging weight loss appeared to drop. During this period, the risk of progression to type 2 dropped to 88% from the earlier 94% and patients also began to regain their lost weight. This implies that tirzepatide, marketed as Mounjaro, might not be a permanent solution for either weight loss or diabetes prevention, and patients might have to take it in the long term to see the best results. The firm added that these results are a summary of the full disclosure, which will take place in November. According to the firm, its drug not only appears to increase insulin secretion but also increase insulin sensitivity, both of which help type 2 diabetic patients in managing their blood sugar levels. Type 2 diabetes is characterized by high sugar levels due to lower insulin production as well as higher insulin tolerance in the body.